Jennifer Hill of the Alliance to End Homelessness in Suburban Cook County. Our team project is called Health Housing Partnerships to Transform Our Suburban Homeless System. Our team includes Lynda Schueler of Housing Forward, Carl Wolf of Respond Now, and Tracy Emanuel, a social worker from Hines VA Hospital, who is not in our video. Our existing team is already developing health and housing partnerships, and we'd like to share some examples.
Housing Forward is a member of the Better Health Through Housing Collaborative, which is a 28-member permanent supportive housing collaborative that is working with UIC Hospital to identify 25 individuals who are high-end users of medical care, as well as homeless, and working to get them housed.
In collaboration with Franciscan Alliance St. James Hospital, Respond Now is providing case management services to the homeless population who frequently use the emergency room. Using a 3-tier model, we connect clients to a variety of services, including emergency shelter, health insurance outreach, prescription medication, and ultimately housing in order to improve health outcomes.
The Suburban Alliance is collaborating with its counterparts in the city of Chicago to create data sharing agreements with the state Medicaid agency and with managed care entities. The goal of the data sharing is to measure the health cost savings of connecting homeless people to housing. We'll do this by comparing health costs in the 2 years prior and the 2 years after being housed.
We each represent suburban homeless organizations and operate in a uniquely suburban context. We are not only challenged by the diversity within our large geography, but in the past decade, the number of people in poverty in the suburbs has surpassed that of Chicago. Unfortunately, our suburban social service net is more fragmented. Only through collaboration do we rise to the challenges of growing suburban poverty and health inequities. Our greatest risk and challenge to building a culture of health is bridging the divide between the health and housing worlds.
Already stretched thin by this growth in poverty, our suburban organizations are finding an increased level of challenge as we begin to create the health and housing partnerships. In each of the partnerships we just described, we are learning that health and housing can be different worlds, speaking different languages. While large nonprofits in the city have already begun to navigate these complexities, such as Medicaid reimbursement or care coordination, we have a lot to learn.
By applying for the Culture of Health Leaders program, our team hopes to bring our uniquely suburban perspective to the program. We strive to become the leaders who will serve as translators and conveners between the health and housing worlds, as well as between city and suburb.